OSF Healthcare is announcing its addition of a cancer center to the St. Joseph Medical Center campus. Here to talk about what this means for an addition to the community is Lynn Fulton, the president of St. Joseph Medical Center. How are you this afternoon, Lynn?
I'm doing great, thank you.
Wonderful. Thank you for joining us here on CI News Day. It's a pleasure. First question for you, what types of services will people have access to now because of this cancer center addition?
Oh, we're really excited to be able to offer really a wide breadth of services, starting with navigation services that will be conducted by a registered nurse. And this is so important. This is an individual that really will be dedicated to partnering with our patient and their family throughout the complicated cancer journey, so that they really have one person and one number that they can call with questions or concerns as they go through their journey with cancer. We'll be offering radiation therapy, infusion services, pastoral care, because we know it's really important to take care of a patient's spiritual needs as well as their medical needs. We will have genetic testing, counseling, and we'll be able to access clinical trials for our patients depending on the type of cancer.
And what does this new center mean for those in the Bloomington-Normal area in terms of quality of life and just overall well-being?
It really is key. It's going to be an outlet for patients to be able to receive really high standard of care. Today the best treatment for cancer is a treatment program that is personalized for the patient, and ensuring that the patient has a voice in that treatment. And so by having that service right here in Bloomington-Normal, our patients will have the benefit of being able to have clinicians that are here and dedicated to Bloomington, but also have that connection to our larger program in Peoria, especially for those rare types of cancer, to have those specialists so close, but yet be able to get a lot of the treatment right here at home.
That's amazing. I'm thrilled to hear it. And you kind of touched on the connectivity to Peoria. So how will those kind of work hand in hand to keep care, just smooth throughout, as you mentioned, that very strenuous cancer treatment process?
It really starts with our physicians. Dr. Crystal Reed is our radiation oncologist that's here in Bloomington, but she works with all of the physicians in Peoria. She actually worked at St. Francis for a number of years and works with Dr. McGee. So those physicians will be tightly aligned, and anytime that Dr. Reed is on vacation or has to be gone for a day, one of those clinicians from Peoria will come over and be able to help our patients. And so by having that tight alignment, they are already peers and already a team. In addition, we are working on our tumor board. The tumor board is a really important component to the treatment of cancer. It's an opportunity for those specialists to come together to discuss, what is the best way to treat this patient's cancer. So you often have the surgeon, the medical oncologist, the radiation oncologist, pathologist, and radiologist all together discussing that patient's tumor. Well, by having that connection to Peoria, depending on the type, we can connect that to the specialist in Peoria virtually, so that we can have those added specialists being able to discuss the care of that patient to make sure we're really delivering that very best care.
And one last question for you, Lynn, while we've got you here on the show. Let's talk about patient safety during COVID-19. So obviously this is a big topic. What practices are in place to keep people safe while continuing radiation and other appointments?
Well, really, we've done the same thing really throughout our facility here and throughout our OSF ministry. Anytime a patient enters any of our facilities, they're screened for COVID-19, which means taking the temperature and asking a series of questions. But probably the most important thing that we do is we make sure everyone has a mask on and wearing it appropriately when they come into our facility. And we ask them to make sure that they leave that on anytime they are within our walls, because that's really the best way that they can prevent that transmission in case they have the virus and they don't know it. In addition, for radiation therapy, we've made sure patients that are being consulted by Dr. Reed, they're up on the second floor of the Center for Health, which is kind of a well area, if you will. We make sure that area, that there's only well patients going in and out of that area, to just make sure our patients that are immune compromised have no chance of being exposed to the virus.
Lynn, it has been an absolute pleasure having you here on Central Illinois News Day. Thank you so much for the information and great great things happening over in Bloomington Normal.
Great, thank you.
And for more on this interview, more information on the Cancer Center, head online to ciproud.com. But of course, don't leave us just yet. CI News Day will be right back.